Vascular disease is an umbrella term used to describe a condition that affects the blood vessels, so that's the arteries, capillaries or the veins. Examples of vascular disease can include things like coronary artery disease, DVTs, also known as deep vein thrombosis, and strokes. There are a number of common conditions that can attribute to vascular disease. Firstly, high blood pressure. When the pressure in the arteries is raised, it can cause damage to the arteries, making them more easily clogged up and also more easy to burst. High cholesterol can also attribute to vascular disease because the cholesterol starts to clog up the arteries, not allowing the blood to flow through them as easily. Diabetes can also attribute to this because diabetes causes the blood sugar levels to be persistently raised, and this too can damage the arteries. Now finally, obesity can also attribute to vascular disease because it plays a part in all of these above mentioned conditions: blood pressure, cholesterol and diabetes. Whilst vascular disease can occur at any age, at any time, and to anyone, there are certain risk factors that make it more likely. For example, as we get older, your risk increases, and if you have a family history of it. But there are also some preventable lifestyle risk factors that you'd be able to try and manage to reduce your risk of developing vascular disease. Smoking. Smoking is the main preventable cause of death in the UK. Tobacco and the chemicals within tobacco can cause plaques to build up in the blood vessels, causing them to become narrow and not allowing blood to flow through as well. But by quitting smoking, after 5 years, your risk of developing a stroke is the same as that of somebody who has never smoked. So quitting smoking is the best thing you can do to reduce your risk of developing vascular disease. Diet. A healthy diet may help you reduce your vascular disease risk by maintaining a healthy weight, reducing blood sugar and blood pressure levels, and by making sure that your blood cholesterol levels are also normal. The most vascular healthy diet is considered to be a Mediterranean diet. That's one low in processed foods, low in red meat, and high in lean meats, fish, and fruits and vegetables, and also healthy oils like olive oil. It's also considered to be lower in salt because of the other flavors, spices, and herbs that are used. Stress management. It's known that moderate and persistent levels of chronic psychological stress can attribute to vascular disease. And that's because stress is considered a pro-inflammatory state, meaning that your arteries can become inflamed. Ways to try and manage this stress can include yoga, mindfulness, meditation, psychological therapies, and in some cases medication. So please do always speak to your doctor if you are suffering with chronic stress. Physical activity. It's now been shown on numerous studies that physical activity and exercise can reduce your risk of developing vascular disease. This is because exercise can help moderate your weight. It can reduce your blood sugar levels, reduce your cholesterol levels, and reduce your blood pressure, as well as help manage stress. The NHS guidelines are such that you should be conducting 150 minutes of moderate activity every week, or 75 minutes of vigorous activity.